What's going on with the pandemic, and then now corralling everybody to this vaccine solution, because it seems like that's what everyone's saying, from Bill Gates to Fauci to even people in the UK government. That's the only solution to get your rights back, or to travel again, or go to a ball game again, or to go to work again. What do you see happening here?
Exactly that. Exactly what you said. That they have defined that there's only two solutions to health. One is a vaccine, and the other is some sort of a treatment, like the hydrochloroquine or the new very expensive medication that they've just approved. And I've listened to a lot of those pressers, and they never talk about health. They never talk about the fact that you can be exposed to a virus or a bacteria and not contract the illness. And why is that? Isn't that where the real science is, Brian? To figure out why, if you've got a classroom full of kids and there's 30 kids in the class and 2 kids come in with strep throat, or 5 kids get the flu, or they've all got colds or bronchitis and they're all coughing or whatever, why is it that the whole class doesn't get sick? They're all exposed. They all are exposed to that pathogen, and maybe only 2 or 3 of the kids get sick. What the real science is determining, what is it about the immune system of the rest of the kids in the classroom that they have a resistance? What is it that's resilient about their immune system that they don't get it? And it's just like the stats now about this SARS-CoV-2 virus, which is the actual name of the virus, right? Is like, why is it that most people that are exposed to it, somewhere between 80 and 86% of people that are exposed to it, don't get sick, or they get a mild type of illness and they completely recover? I mean, that's where the real science is. But instead, it's the agenda. It's the agenda to vaccinate the world. And Bill Gates has been pushing for this for a long time. They've trial ballooned things like social conditioning in Argentina. And that was a few years ago, when in Argentina, they said you cannot renew a driver's license and you can't get a passport unless you show a completed vaccination record. And I've been talking about this for probably 4 or 5 years, saying that this was coming. This is coming. They're going to be pushing this. And that's when in 2015, when they passed SB 277 in California, which removed parents' rights to refuse. That was in 2015. I said, this is where they're going with this. They're not going to make it mandatory to get the shot, but they're going to make it so unbelievably difficult to live without the shot. Like, you can't travel, you can't get a driver's license, you can't go to a ball game, you can't even access your health insurance. I mean, they've been kicking kids out of pediatric practices for years for not vaccinating. Well, they're going to start doing that with adults next. And I've already started to hear it around here. I live in Cleveland, Ohio. And I've started to hear certain places that if you're not going to have a flu shot, then I'm not going to be able to be your doctor anymore. And so they'll make it so it's so uncomfortable to not get the shot that you'll just roll over and do it. And the vaccine that's coming out now, this experimental vaccine that they're doing they're developing, I just checked this morning, they now have 8 to 10 candidate vaccines that they think are the ones that they're going to put into the clinical trials. When they bring this vaccine to market, it's going to harm people and probably kill a lot of people.